This is Talk with Audrey. Welcome back. COVID-19 continues to upend normal life and puts stress on individuals, families, communities, and businesses alike. And while much of the world's population is exercising social distancing and experiencing this total lockdown to protect our health, some of the resulting feelings of isolation may exacerbate two other growing health concerns. That's loneliness in the elderly and the ongoing global mental health crisis. My guest today is Dr. William Kassler, Deputy Chief Health Officer and Lead Population Health Officer for IBM Watson Health. We're going to talk about tech and how it can help individuals, businesses, and communities protect mental health. Welcome.
Thank you. Good morning.
Good morning. Good morning. Let's talk first about IBM Watson. I'm not so sure that people are familiar with Watson. So if you talk to us first about IBM Watson Health.
So Watson is a suite of technologies that involve big data, AI, advanced analytics. Watson Health is applying all of those technologies to improve health for individuals, for doctors, for hospital systems, researchers, and governments.
And so you've collected a lot of data, so you know a lot about people, about trends in health, and specifically how technology can play a role in helping to inform us all, including healthcare providers.
Exactly. And when you say we collect data with people's consent, and we work with doctors and hospitals and researchers. So we are not about spying on people or collecting data without folks knowing.
Right. Well, I made an assumption, given that it's healthcare, that it was given with permission or gathered with permission. So, but thank you for those folks who might take it the wrong way. So thank you for that. Okay. So the global mental health crisis during this COVID-19 pandemic, people are feeling, stressed. If they're normally social, I think that they're feeling more stressed and impacted by the shelter in place, basically, because they're used to going out. And then there are people who, it's not affecting at all. What's the difference between the two personality types, someone who's social versus somebody who's, say, a loner?
So we have introverts and extroverts, people who get their energy from socializing, from being out there, and folks who like to have quiet and downtime. But whether you're an introvert or an extrovert, these are unprecedented times, and the stress and anxiety of worrying about ourselves and our loved ones, the economic disruption, the social disruption, that impacts all of us, whether we're naturally introverted or whether we're naturally extroverted.
And this isolation is impacting loneliness, I understand, amongst the elderly population more than ever.
So we knew prior to the pandemic that loneliness and stress and anxiety and mental health were hidden public health problems in their own right. And then comes along the stress of pandemic and all of what we just talked about, and that just simply adds to it. The irony, of course, is that the social distancing helps the elderly who are particularly vulnerable about getting sick with COVID and really getting quite ill, but at the same time, it disproportionately affects them. The elderly are prone to isolation and loneliness beforehand. So this epidemic has really brought out the public health crisis of loneliness. And we believe that tech can help, that tech is part of the solution.
So could you tell me how that looks?
So while tech is never a substitute for high-quality, face-to-face interpersonal interactions, we know that there are a lot of technologies that are being applied to help people cope. One of those technologies is simply enhancing the radio and the telephone conversations we have with our loved ones by adding gestures and pictures and nonverbals, which can be helpful. But we know that technology can help coordinate care, get needed services to folks who are locked in and keep them safe at home. There are mobile apps that help with stress and anxiety and mindfulness. There are online counseling platforms, for example, that can remotely counsel. And then simply the telehealth that we're all just getting used to. The technology that drives that can make it easier for providers to adapt and to do high-quality visits, and can make it easier for people who need those services to access some of the care remotely.
And when it comes to the elderly population, some of us, I would be considered elderly, quite honestly, fall into that AARP group, are not as savvy with tech. How do you overcome the challenge that an elderly person might have if they're not really able to use the tech?
So we've actually found that it might be counterintuitive, but the elderly aren't as bad with tech as we think or fear. It turns out that if there's a strong motivation, like connecting with your kids and grandkids, if the tech is well designed, if the user interface is friendly and intuitive, that the elderly take to the tech just like anyone else. And so we found that there's a lot of really good tech out there, but there's a lot of bad tech. I kind of liken it to the wild, wild west, the good, the bad, and the ugly. And so it's important for all of us to curate those lists and to recommend tech that works, that's easy to use, that's safe and effective, and keeps us private.
So I know that the social distancing is good for the elderly when it comes to their physical health, but the mental health aspect of that has an impact on physical health. Yes or no?
Oh, absolutely. So it turns out that loneliness, for example, we think about that as harmful to our mental health, but loneliness is equally harmful to our physical health. Science has shown that being lonely is about equivalent to smoking 15 cigarettes a day, the same order of magnitude as physical inactivity or obesity.
That's incredible. So if somebody is sitting at home and they're depressed and having another mental health issue, their body is responding to that as well.
Exactly.
And perhaps exacerbating some other problems that they have, maybe like memory loss or any other issues that might be in place.
You're absolutely right. I mean, no longer is the brain and the body disconnected. We're really increasingly seeing that the mind and the body are one, and that our mental health is so tied to our physical health. And so it turns out that as the pandemic is stressing us and making things worse, there are really some concrete things, simple things that we can do to take care of ourselves, to build resilience, to adapt, and be well in these circumstances. I like to say that just like when you take a plane and they tell you to take the mask on first before helping other people, self-care is so important these days to our own physical and mental health, but also our ability to help our loved ones. So examples might be making sure that we get enough to eat and incorporate physical activity into our daily routines, keeping some level of normality by doing hobbies or things we like to do, using technology and reaching out to loved ones. Just because we're physically distant doesn't mean we have to be socially distant. Finding things to be appreciative and grateful for every day. I like to look out my window and watch the birds, for example, and I like to cook for my wife and son. So all of those are self-care techniques that we can and should be trying to employ.
When it comes to mental health, Doctor, has there been this increase worldwide? And if so, what do you think contributes to that?
So we knew before the pandemic that mental health was a huge issue, and companies like IBM and others were really working as employers to recognize and address and help our employees. So within the United States, for example, it turns out 1 in 5 American adults have some form of mental health. And what's really challenging is that 60% of them don't get the treatment they need, far higher than for physical ailments, because of the stigma, the lack of access. And again, I'll go back to technology and say we think technology can help by helping access where there are no providers, where there may be stigma, where people might be willing to reach out through technology but not face-to-face because of the stigma.
And how can technology work if someone, is there something like a real self-help kind of tech that you guys are thinking about developing that would allow someone who, A, doesn't have the financial resources or, financial resources and or health coverage that will cover, mental health treatment? You mentioned that, and I think it's an issue.
There are a lot of things here. There's no one solution, but I'll tick through them. I think mobile apps can help, some of which are free, others of which are very, very low cost, that go through relaxation and guide. I would call them mental gyms, if you will, mind gyms, that will help you to do exercises and self-care exercises. There are online counseling platforms that allow for counselors to work with people who can't physically come in or who can't travel or can't afford a visit. There are remote telehealth visits with providers, many of who offer low-cost services. There are free hotlines, so that there are a lot of resources out there loosely using and leveraging technology to help.
Well, I'm going to have to check some of those out. I use one app that sort of helps me relax. It plays white noise, and it has ocean and raindrops, sounds that, could help you feel better and relax. You can choose your own. I find something like that to be very helpful. And technology has indeed come a long way to helping people deal with some difficult times. So where can people go for more information?
On the web at IBM.biz, BIZ/COVID health.
Wonderful, wonderful. Well, Dr. William Kassler, thank you very much for joining me. And everybody out there, this is a tough time, without a doubt. You might have lost your job. You might have lost a loved one. You might be elderly and at home. Even young people, by the way, are exhibiting, from what I understand, doctor, some signs of depression. Just dealing with the lack of socially being able to get out with their friends and run and play and have a good time, right? So, indeed.
This is disrupting for all of us.
Yeah, it really is. It's amazing that the impact that this has had. And, quite honestly, it's taken the Band-Aid, I think, off of a lot of things that have been going on under the radar. So, guys, check out that site again. Your mental and your physical health are both intertwined and important. Dr. William Kassler, the Deputy Health Officer and Lead Population Health Officer for IBM Watson Health, has been my guest. Check out the site. Thank you so much for joining me, Doctor.
Thanks for having me.
My pleasure.